Do you know the difference between type 1 and type 2 diabetes? Welcome to Channel Health Alerts, your ultimate guide to understanding and navigating the world of health and wellness. Today, we'll unravel the differences between type 1 and type 2 diabetes, two diseases that share a name yet have distinct causes and effects on the body. Type 1 diabetes is an autoimmune condition, a case of mistaken identity where the immune system confuses healthy cells for foreign invaders. This misinterpretation leads to an attack on the insulin-producing beta cells in the pancreas, rendering the body unable to produce insulin. You can think of it as the body not having the key, insulin, which is crucial to feed the body's cells with glucose. On the other hand, type 2 diabetes is a condition where the body produces insulin but can't use it effectively. This is known as insulin resistance. Several factors contribute to this, including being inactive, being obese, and other genetic and environmental components. In this scenario, the body does have a key, but it's broken. Despite their differences, both types of diabetes disrupt the regulation of blood sugar or glucose, the vital fuel that feeds your body's cells. Both also increase the risk of diabetes complications, a topic we have covered in detail in a previous video. Risk factors for type 1 diabetes are less clear, but having a parent or sibling with type 1 diabetes increases the risk. It can appear at any age, but it's most common among children and adolescents. On the contrary, the risk factors for type 2 diabetes are more defined. They include prediabetes, obesity, a lot of belly fat, being physically less active, being aged over 45, having gestational diabetes, and having an immediate family member with type 2 diabetes. Treatment for type 1 diabetes involves regular insulin intake, either through injections or insulin pumps. Type 2 diabetes, however, can be managed and even prevented with diet and exercise. If lifestyle changes aren't enough, doctors may prescribe medications that help your body use insulin more effectively. As for prevention, type 1 diabetes can't be prevented, but it may be possible to lower your risk of developing type 2 diabetes through lifestyle changes. Refer to our other videos on diabetes, links in description box. Type 1 diabetes is less common than type 2, with about 5 to 10% of people with diabetes having type 1. It usually develops in children, teens, and young adults. Conversely, type 2 diabetes is much more common, with 90 to 95% of people with diabetes having type 2. Always consult with your doctor. Thank you for spending your valuable time with us today. Remember, resetting your health is the first step to resetting your life. Stay tuned and stay healthy.